Hi everyone, my name is Rosie. I'm a psychiatry higher trainee. I've recently completed a fellowship in simulation with Motivational Simulation, so in the same team that Leonie is working with. And if you're not aware, we're a simulation team based in South London, and we specialise in mental health simulation. So I'm here today to talk to you, just to share some work that we've been doing around combining simulation training, but also the concept of motivational interviewing in one training course. And I guess the starting point for this was that although we're largely based in mental health, I think hopefully this is a familiar situation to everybody, regardless of which specialty or setting you work with. When you have encounters with patients, there's a degree of coming up with a treatment plan, and how are you going to encourage that patient or client to go along with that treatment plan? How do they feel about it? How can you maximise the chance that that's going to go well? And it may involve, making some changes in their life. So it could be to do with stopping smoking, reducing their alcohol use, but it could be to do with whether they take their medications or not, or will they do the physiotherapy exercises that you ask them to do. So we're aware that that can feel like a rather frustrating situation for health professionals, and it doesn't matter, you can have all the lovely facts and sort of rationale as to why patients might want to make changes in their lives, but actually, do they actually do it, and are they in a position to make those changes? Likewise, I guess when it comes to lifestyle changes, you may be seeing that patient for a completely different reason. So, for example, you might have a patient who comes into A&E who's fallen over and hit their head, but actually you're aware they're drinking quite a lot of alcohol. How do you broach those subjects with patients in a way that feels non-judgmental and feels relevant and helpful to them? So we're hoping to draw upon the techniques from an approach called motivational interviewing. To those who aren't necessarily very familiar with that, it's a counselling approach that really aims to be patient-centred. And I'm going to do a very bad job of summarising this, but basically it's a kind of a curious questioning approach to encourage patients to just reflect upon their own motivations. And it may be around thinking about pros and cons, thinking practically about what they want to do next. So it's a technique that we were hoping to draw upon and put into our simulation training to upskill health professionals. So I'm out of breath now. So just quickly to summarise, we actually created 2 courses. So the first one is called Healthy Lives, and it's a 2-day course where the first day was really much dedicated to learning these skills and learning these approaches, so group work. And the second day was a full day of simulation to enable the participants to put their skills into practice. And this course was, I think it's been delivered 6 times, is it on 6 occasions, or maybe a bit more?
Maybe a bit more.
Yeah, a bit more. 10 times to a wide variety of audiences, so ranging from sort of healthcare professional and healthcare assistants, based in inpatient and outpatient settings, to an audience based within social care who work with young people, for example, who are care leavers. Again, looking at different lifestyle choices that might be affecting their well-being. The second course is called Opportunistic Interventions in Alcohol and Substance Abuse, so it's just a 1-day course, open to all health professionals, with the focus on substance abuse, and really taking that opportunistic approach. So your patient's here to see you about something else, but you'd really like to speak to them about substance use. How are you going to bring that into the conversation and make it feel therapeutic? So we've been sort of delivering these courses, and the results that we've got have been promising. So using pre and post questionnaires and qualitative comments, the combination of those 2 modalities, so using the motivational interviewing and the simulation training, seems to really improve our participants' knowledge of the technique, but also their confidence in raising these issues with patients, and their attitudes to actually, yes, this is something that's actually part of my job and I can do this confidently. So I guess just to finish, we hope to do more of these courses, and I think a really interesting one about the Healthy Lives course is that it's been something we've been able to take outside of the health environment, so within to social care. So I think there's a lot of interesting possibilities there. So thank you.